Hi, I'm Dr. Teresa Sharp, Director of the University Counseling Center and a psychologist, and today I'm going to be talking to you about electronic health records. Electronic health records, or EHR, are real-time digital client or patient-centered records that include mental health and medical history, diagnoses, medications, treatment plans, case notes, consultations, assessments, lab and test results, and often much, much more. And again, it's going to depend on the setting that will dictate what is in a particular EHR. Many of you have probably had some exposure to EHR systems already, perhaps at a site where you're currently doing your training or at a site where you've worked, or maybe as a patient yourself. Perhaps your primary physician uses the EHR and you've had to log on to get lab or test results or to cancel an appointment or schedule an appointment. So you probably have a little bit of a context for all of this. One of the benefits of EHRs, especially for an integrated behavioral health team, is that unlike a paper record where you have to go and get that paper record chart out of a locked cabinet and only one person can have access to it at a time, basically with an EHR system, it can be created, managed, consulted by authorized users across different units or departments, and potentially from off-site locations too. So it really enables easy access and exchange of information by a treatment team. And certainly this year, where many facilities and providers were needing to move to a telehealth model, EHRs were what really made this possible. Another benefit of EHRs is that they enable efficient and accurate workflow for providers. So often they'll have a feature that will remind providers to start a note or complete a note. Often an EHR will include reminder systems that enable providers to set reminders, for example, to call to follow up with a patient. And they can also incorporate features such as billing or patient portal. And again, as I mentioned already, they may be part of a telehealth service platform, and really perhaps even the backbone of that. Another benefit of EHRs is because all the data is digital, it allows administrators to run reports for various reasons. It might be to analyze clinical utilization patterns, to look at things like what is the most common diagnosis that we're seeing, to compare provider caseloads, to look at things like how long is it taking particular providers to finish their notes. So just a real variety of ways that administrators can use an EHR to run reports and get data. So as a trainee, you are not going to be in a position where you are selecting an EHR system. You're likely going to be using whatever EHR system your site is using, provided that they have one. However, there may be a point in the future where you will be in a position where either perhaps in private practice or an administrator role, where you may either need to evaluate a system or select one. And so really kind of thinking about what do you need the EHR system to do? Most include scheduling and clinical charting capacities, but sites that have trainees also need the capacity for notes to be routed and signed off by supervisors. Other features like text or email appointment reminders are helpful to have if you are anticipating doing telehealth, and having a feature that allows clients to do paperwork online, check in online, do symptom checklist or assessments like the PHQ online can be helpful. If you have medical providers on staff that are issuing prescriptions, then being able to do electronic scripts can be helpful. Having billing built into the system if your site bills to insurance. If you're anticipating doing telehealth, then an EHR system that has some sort of video conferencing feature that's secure embedded within it, or compatibility with a system can be helpful. And then just being able to do secure messaging with clients can also be helpful, and then being able to run reports. Other considerations would include the number and type of providers and the type of facility. So there are some EHR systems that are really designed just to be used in medical facilities. There are others that are really designed to be used just really in mental health facilities. And then there are some that are more integrative. Some are designed for solo practitioners or small practices. Some are designed to be used with large facilities. So sort of thinking about those sorts of things as well. Also thinking about the availability of technology for providers. Usually with EHR systems, providers are going to need to have access to a laptop or a tablet or a desktop computer. And then also thinking about what sort of technology do the consumers need to be able to access, and will we have that available for them on site? For consumers with limited access to technology, how will this work, and will it be feasible, kind of given the population that we serve? So really thinking about those sorts of things. Most EHR systems are going to promote and build themselves as being HIPAA compliant, but really kind of needing to look critically at kind of the implementation and the end use and sort of the HIPAA compliance and privacy piece. Cost is very often a critical factor when making a decision about an EHR system, and affordability. However, I think more and more centers are finding that implementing an EHR system just on a lot of different levels is very important and vital for service delivery. And so really sort of looking at that cost as an investment. Many EHR systems are now moving toward a cloud-based system if they're not already kind of offering that option. Some of the older systems may still be hosted on servers. And so really sort of looking at that too in terms of just accessibility, also asking questions about the availability of tech support to help with onboarding and implementation and troubleshooting. Often cloud-based systems are less likely to crash as opposed to ones that are hosted on servers. And then what will be provided in terms of training and customer support after purchasing the product. And again, if you're a solo private practitioner and purchasing an EHR system, then it's likely that customer support will be via chat or calling an 800 number, and sort of learning the system is going to be video tutorials as opposed to implementing a system with a larger facility, in which case there would probably be an expectation that the EHR system provided some training and to the staff. And then if it's a situation where your facility is transitioning from another system, what's the process for migrating data from the previous EHR system if there was one? Because this can be a pretty technical and labor-intensive process, migrating data. And then looking at, are there default clinical documentation templates that are provided? Can these be customized, and likewise for things like appointment codes? So some of the barriers to implementing an EHR system I had already mentioned, that sometimes cost can be prohibitive, or perhaps because of cost, a particular facility is not able to upgrade the system that they're using, or maybe transition to a preferred EHR system just because the cost is prohibitive. Other considerations are just certain systems may require particular types of devices like iPads or laptops rather than desktops. And so just depending on the budget for a particular facility, these may be barriers. Not exactly a barrier, but just something to be mindful of is that anytime a system is upgraded or a new system is implemented, staff need to learn that new system. And there may be a steep learning curve for individuals who are a little less tech savvy or who don't have prior EHR experience. As a trainee, it may be a little daunting trying to learn a new EHR system. But just important to be patient with yourself and to ask questions. What I've found is that often our trainees catch on really quick initially, but may have questions later on, which is natural. The other piece, and again, not really a barrier necessarily, but the importance of educating and assisting consumers in transitioning to a new system or kind of acclimating to a system when they become clients or patients if this is new to them. And then, identifying, understanding any barriers to utilization. So the system that we use at the counseling center pushes out text message and email appointment reminders. But, one of the things that, we are cognizant of is, that not, all students have access to text message. And so, needing to make sure that there's a way that they can be notified about their appointments. Likewise, some students may have access to a webcam on a laptop or have one on their phone, but others may not. And so just being mindful of these things and trying to navigate sort of any potential challenges that a client may have. Also, taking into account the complexities of transitioning from one EHR system to another, if that's the case. So things like data migration, data validation, creating or customizing templates and appointment codes. Again, not barriers, but just, challenges in implementing a new system. And likewise, if a particular facility has always had paper charts and now they are moving to a system with electronic health records, then needing to kind of figure out things like, are we going to scan those records into the new EHR system? Or, basically, will we keep paper files, until, it's the appropriate time to destroy those? So kind of just thinking about these sorts of things. The other consideration is that it may be difficult to implement a new EHR system without impacting service delivery, at least temporarily. And so when the counseling center transitioned to a new EHR system in January, we really needed to have a period of time when we stopped using the old system and then were able to onboard with the new system. And so it was a pretty brief period, but during that time we had to go back to using paper notes and then later scan those notes into the new system. And likewise, kind of, during that time, we didn't have the capacity to do things like, send text message appointment reminders. And so needing to do other things like call students to remind them of their appointments. And again, not a barrier per se, but something to consider is really kind of thinking about what's the contingency plan, what are the backup protocols if the system is down or not accessible due to a natural disaster or some other kind of emergency. And this is a very real possibility where we are with hurricanes, that providers might not have access to electricity or internet access. Right now, up in Iowa, they had some pretty severe storms, and my sister-in-law is a social worker at a hospital, and their electronic health record system has been down all week, and so it's really been challenging coordinating patient care without having access to that EHR. It really has become very, apparent how vital and that is in terms of being able to manage patient care. So thinking about those kinds of things. Okay, so just a few other things to be mindful of with EHR systems. Because this is a digital record, once a note has been signed and locked, it really is permanent. I mean, we shouldn't obviously ever change a paper chart either, but understanding that electronic health record notes are time and date stamped, and so just anybody can see when that note was completed, and so the importance of being timely with documentation. If there's something that you don't understand about the system or how to do something, it's important to ask questions. Look at the help section for the EHR program. Most systems have features that allow administrators to restrict access to certain charts, and then also allow administrators to audit who has access to chart. So if you shouldn't be looking at a chart, even though perhaps you're able to, just don't do it. And if there's a reason why there's a particular chart, perhaps someone is using that clinic, let your supervisor know so that they're able to block or restrict access to that chart. Understand that just, we all make mistakes sometimes. Sometimes with an electronic health record note, what might happen is that you're writing a note, and then after the fact, and this doesn't happen too often, but after the fact you recognize, oh, I'm actually in a different client's chart, but I've already signed this note. Often EHR systems, there are, ways that either, administrator can delete a note later if it's been made an error, or notate that has happened. Perhaps you forget to incorporate something into the note. Many times these systems have a way of adding an addendum. And so there are just, ways to kind of address those mistakes, but important to consult with your supervisor about that if you need assistance with that. And just, like we treat a paper chart, and really kind of safeguard that and kind of make sure to keep that locked up and in a private location. Very important with an EHR system to choose a secure password, to always log out of the EHR system when you step away from your computer, even briefly, because that right there is a risk. If you step away from the computer and then someone else, even another provider, is able to see that screen that you have open, or perhaps someone from who does housekeeping for the facility, it kind of walks by and sees, confidential client data. We just don't want that to happen. So just really get in the habit of always logging out of the system when you step away from your computer. Very important to follow facility protocols regarding accessing EHR systems from off-site locations. So if that's not permitted, don't do it. Even if you know how to do it. If off-site access is permitted, make sure that you only access the EHR in a private location with secure internet connection from an authorized device. Okay, so you don't want to be looking at the EHR system when you're on, airport Wi-Fi or in a coffee shop. That's just not appropriate. And so really being mindful of those things. I've been talking about different EHR systems and wanted to give you a little tour of the one that the University Counseling Center uses. It's called Point and Click. It's also used by the University Health Center, and so it's a program that was designed to be used by both University Health and Counseling Centers. Because our two centers are not integrated clinics, we have a firewall between the Counseling Center side of Point and Click and the Health Center side of Point and Click. We transitioned to using point and click, implementing it in January. Prior to that, we had used another system called Medicat for about 10 years, but Medicat really was not meeting our needs and was not so compatible with our workflow and was not so user friendly for our clients or patients either. So we made the decision that we really needed to move to a new system. We did a lot of research, looked at a lot of different products, and made the decision to go with point and click, and then spent several months last year preparing for that transition. And that was a process that was really led by our administrators at the counseling center and health center, but also aspects of that were shared by the staff in terms of having to validate data when we did the data migration from Medicat to point and click. That was a pretty intensive process of making sure that everything was mapping correctly. Because we were moving to a new system, there were also opportunities to change things that we had been stuck with in our old system, like appointment codes and different types of documentation templates. But getting those ready, customizing those in anticipation of moving into the new system was also labor intensive. One of the things about transitioning to a new system is that when you basically stop using the old system and start using the new system, there's a very small window there, because you can't really afford to suspend services to clients, and so, but then you also need time to train your staff on the new system. Working in an academic setting, in this respect, I think has some advantages in that at the University Health and Counseling Centers, we typically, are not seeing too many students, after mid-December when the fall semester ends, and then, typically are seeing students again in mid-January or late January when the spring term starts. But there's always a little bit of a trickle even between semesters, and of course staff take vacations and this sort of thing, and so that was one of the challenges that basically kind of needing to bridge between the two systems, and then kind of very quickly get our staff trained in a new system that in a lot of ways was much more complex than the previous system that we had used. So what we're looking at here is the calendar, the schedule screen. You can see the provider columns and some of the meetings that are scheduled. Here on the top, these little bubbles. This system also has an instant message system that allows providers and staff to send secure instant messages to one another. I had gone ahead and scheduled an appointment, so I am going to, essentially this test client has already been checked in, so I'm going to go to the note. I've already played with it a little bit, so it gives me that prompt. So now what you're seeing is, and this was a really nifty feature that we didn't have in our old system, is that once the appointment is checked in, it automatically takes me into the client's chart and actually into the note that I need to complete for that particular session. And the note has a lot of buttons here, so it just makes it pretty quick to do the charting. Some pop-up boxes. Okay, so it's not going to let me finish finish it because there's a lot more that I need to do there. Okay, but I want to show you some other parts of the chart here. So if I click on, okay, let me show you the notes. Oops, I need to. Okay, I popped open another test client just because with the other one, because I hadn't finished that note, it was blocking me a little bit from navigating around the chart. I wanted to show you some other things. So this is also really nice, just kind of a quick chart summary that, and it has the capacity to put alerts. So then when a provider is looking at the chart, very quickly can see if any alerts have been put there. The encounter pad basically shows the different notes and templates that are available. And show you this one. So this is a really nice feature that works really well within our system, that we can use this particular note to make a referral to the case manager. So the provider would, fill out this top portion, basically kind of indicating, whether the client wants to pick up referral information, if the primary counselor is going to pick that up, if the individual wants a follow-up from the case manager, and then sort of what the primary needs are. They fill all of that out, and then they sign, and then they can route the note to the case manager, and then it pops into the case manager's inbox. And then we have a similar note for the psychiatrist, that we can consult with the psychiatrist about any medication side effects. The provider fills out the top part of the note, and then the psychiatrist can move it back. Other parts of the chart that you can see here are the appointment history, allergies and medications, diagnoses that have been assigned, and again, this is a test patient, so there may not be too much in here. Another feature of the system that's really nice is that it includes a patient portal, and so the capacity to send clients secure messages through the portal, and then the client is able to respond to those messages. And I'm not able to show you the patient side of point and click, but the patient or client is able to log into the patient portal and see information about upcoming appointments. They can complete forms in the portal. So it's just, very accessible and easy to use for the client and patient. Another nice feature of point and click is that it has really powerful reports and analyses that you can do. So as an administrator, just a variety of different reports that I can run, or customize some of these. And so again, this data, over the number of years, it isn't going to be completely accurate because of some of the issues with the data migration and certain fields in Medicare not mapping up completely with those in point and click. But still, just sort of a nice graphic way to show some of this. And then variety of kind of standard types of reports that can be run. So just very user-friendly and helpful in terms of kind of having all those options available. So now I'm in the registration field where the client's address, date of birth, academic details, all of these are in here. One of the things that has been interesting about our transition to point and click is really the timing of it. So in a lot of ways we felt very fortunate that we were now using a system that was cloud-based, that we could access very easily from remote locations when our providers were needing to work from home since March. However, point and click had only fairly recently begun to kind of build out features that were compatible with telemental health, and and we had not purchased all of those features, and you know, frankly, some of the features were still in the development phase. So you know, what we were seeing was, you know, for ourselves, and you know, some workarounds in terms of sort of knowing what we needed to do when we had to very quickly adopt a telemental health model, and you know, trying to kind of make things work essentially. So initially we really did not have the capacity through point and click for clients to complete forms through the portal, and so we were needing to have clients download forms from our website, but then they were able to send them as the completed forms back to us as attachments through secure messages in the portal. But just pretty complicated process, which, you know, as point and click has, you know, kind of quickly kind of upgraded and developed kind of features that really are pretty necessary when doing telemental health, then has been able to pass those along to their customers, which has been a big benefit. Well, and lastly, as I sort of wrap up our tour here, I think the Counseling and Health Center were just in a fortunate position that in January, you know, budget-wise, we were able to transition to a new system. And I'm well aware that many of the facilities in our area, you know, have, you know, pretty severe budget constraints, and are, you know, are needing to kind of utilize EHR systems that are pretty antiquated, or that they've been using, you know, for many years, and that just, you know, it really is not, you know, feasible or possible to transition to a new system. I think the other consideration too is the population that a particular you know, clinic or facility serves. So in our case, we are serving university students exclusively, and so some of the features of point and click, you know, in terms of text message notifications, you know, being able to do check-in from a laptop or a tablet or a mobile device. Most of our students have access to this technology, so that they've been able to participate in telemental health. They have a webcam, but certainly not all. And so just, you know, we have had to, you know, look at, you know, what are some things that we can do to support individuals who, you know, maybe do not have a reliable internet connection, or that don't have a webcam on their phone or laptop. So overall, even though it's been a little bumpy at times, both on the provider side and also with our clients sort of adjusting to the new system and learning how to use it. But kind of in spite of all of that, we've really been pleased and kind of grateful to have access to this system. And overall, it's been really working well for us. And just Point and Click continues to roll out new features, which, again, more for us to learn. But lots of opportunities there, both for the full-time staff and also our trainees. So this is a list of some different EHR systems, and certainly not an exhaustive list. There are many, many more. Medicat is the system that the Counseling and Health Center previously used, and now we're using Point and Click. Pyramid is a system that's used by university health clinics. Meditech is used in healthcare settings. I believe Bayview Behavioral uses Meditech. Titanium is a system that's pretty affordable and used by many university counseling centers. I should mention that programs like Medicat and Point and Click are conducive to using an integrative setting that incorporates both counseling and health. Even though both the counseling center and the health center use Point and Click, we're not integrated, so we're separate clinics. We don't share records, and so we use the same system, but we have a firewall, so we can't see health center records and they can't see counseling center records. There are also a lot of different software EHR systems geared toward private practice or small group practices. Therapy Notes, Theranos, Simple Practice are some of the popular ones, but there are others. Often these will offer a 30-day free trial. And just to keep in mind, though, that if you don't purchase the program or a subscription to it after the free 30-day trial, then you won't have access to anything that you've put into that system. So you probably don't want to put any client information into the system. Use that 30-day instead to sort of explore the system, play with it, make sure that it's going to be a good fit for you. So in summary, EHR systems provide a comprehensive and efficient platform to maintain and manage patient charts in a real-time digital format. As I talked about earlier, many systems also include other features like billing and appointment notifications and patient portal or video conferencing that help to optimize service efficiency and delivery, and which honestly patients and clients really appreciate. It makes it more convenient and easier for them. For integrated behavioral health service teams, the EHR platform allows team members to access and update the client chart and communicate with other members of the team and the client to facilitate treatment and discharge planning. So an example of this is at the counseling center. We have counselors on staff, we have a case manager, we have a psychiatrist, and so when a counselor wants to make a referral to the case manager, they can basically fill out a case manager referral form within the EHR system, push that to the case manager, and then she has that information, and then she's able to follow up with the client. If a client is having difficulty or problems with their medication, side effects, then the counselor can generate a consultation note to the psychiatrist and then route that note to the psychiatrist. And then the psychiatrist is able to populate that note with her instructions or directions and then push that note back to the counselor, who then is able to follow up with the client. And so just sort of a small example of how the EHR system really facilitates that communication and consultation. And makes that very easy. Even, if the providers are scheduled at different times or, are, not able to kind of speak to one another face to face, they're able to share the necessary information via the chart. EHR systems also enable supervisors to easily access and review and digitally sign supervisee charts. They can also do things like putting sticky notes and feedback on notes for supervisees. So again, very conducive to the supervision process. EHR systems are often a key component in telehealth service delivery and allow providers to access the client chart remotely, and for clients to complete forms and assessments online. So this really kind of enables that continuity of service, even when a provider and a client are not able to kind of work with one another face to face. And certainly the pandemic has necessitated a lot of facilities moving to a telehealth service model. But we also know that there are individuals in rural communities that do not have ready or easy access to mental health or medical providers. And so, for these individuals, populations in remote and rural locations, telehealth may be the only model. And again, EHR systems are, typically just a very integral part of that telehealth service model. There are limitations inherent in EHR systems, but by and large, they are a very powerful platform to support quality client care, especially for integrated behavioral health service teams.